Jennifer, no. Okay, thank you. Good afternoon, everyone. This is Wednesday, March the 27th. This is a meeting of the Government Operations and Health Facilities Subcommittee of the Health and Government Operations Committee. We are considering 4 Senate bills today, and we'll consider them in this order. Senate Bill 210, Senate Bill 252, Senate Bill 255, and then Senate Bill 1103. We do have the full subcommittee at 1:30, so we'll hopefully get through these 4 bills. Let's start with 210. Lindsay?
This bill is a departmental bill from MIMS that extends by 5 additional years until January 1st, 2030, the provisions of law that authorize a paramedic to administer influenza and COVID-19 immunizations as part of a population health outreach effort conducted by the appropriate local health department or a hospital or a health system in the state. This bill is extending previous provisions of law that allowed this. It was initially set to terminate January 1st, 2023. It was extended to January 1st, 2025 and 2020 during the 2022 session. And this is just extending that yet again.
It extends it for 5 years, is that right?
Yes.
Okay, thanks. Any discussion on this bill? No amendments. Oh, Delegate Chisholm, go ahead.
Well, I think you just hit on what I was going to ask. Was there any amendments? I'm just looking at the committee testimony over in the Senate, and it's obviously got a ton of unfavorable. So I didn't know if any work was done on the bill to try to appease some of the unfavorables, or if this is just this was initially drafted legislation.
Well, it's tough to know what the opposition was because most of the unfavorables provided no testimony.
Right. There's some. I've loved Maryland Pack and a few others. Okay. But I guess my question is, there was no amendments made to this bill.
Yeah.
Okay.
No amendments. Delegate Shalega? We can't hear you. There you go. One more try.
Sorry, I was just going to point that out and I didn't get my hand down in time, and then I can't figure out how to use mute, unmute, apparently.
Okay, good. Either. All right. Do I hear a motion on this bill? Okay, Delegate Johnson moves.
Second.
And Delegate Zone second. All right, all in favor of the bill, say aye.
Aye.
Who's opposed to this bill?
You see us, Ken? Chisholm and Shalega.
I do. Chisholm and Shalega are in the no column. All right, thank you. Moving on. Lindsay, Senate Bill 252.
This is also a departmental bill. This one's from MDEM, as is the next bill. This is an emergency departmental bill clarifying that money collected from the state 911 fee may not be used to pay the salaries of public safety answering point personnel or county personnel, while money collected from the local 911 fee may be used for those purposes. MDEM advised that this is just clarifying the existing practice that they have because they've been getting some questions on it.
And no amendments, no opposition.
Right.
Delegate Kaiser.
Thank you, Mr. Chairman. I mean, it does sound technical. I just want to confirm it's not conflicting. It's just complementary to the other 911 bill we passed.
The one that you're referring to, I think, is the training for the telecommunications CPR, and no, that this doesn't conflict with that.
And I also thought there was one that had the 25-cent fee, or am I thinking of the wrong 3-digit call line for that?
That's the 980.
That's the 980.
Thank you. As you all know, we all get all of those confused. Okay, sorry about that. Thank you, Mr. Chairman.
No, I think you're probably not the only one who had that confusion.
Move the bill.
Thank you. And a second from Delegate Paredes. Okay, all in favor of the bill, say aye.
Aye.
Any opposition to this bill? 252 goes on to the full committee with a favorable report. Lindsay, SB 255.
This is another departmental bill from MDEM that transfers the Volunteer Company Assistance Fund from the Military Department to the Maryland Department of Emergency Management. Again, this is sort of a technical change because they were managing this fund back when they were under the military department.
Yeah, another no opposition, no amendments. Do I hear a motion on the bill?
Move the bill.
Second.
All right, we have a motion, a second. All in favor of the bill, say aye.
Aye.
Okay, any opposition to this bill? The bill moves on with a unanimous vote from the subcommittee. Thank you, Lindsay. Aaron, you're up. 1103.
Okay, so this is Senate Bill 1103. The cross file to this bill is House Bill 1149, which HGO heard on March 6th. It's an Office of the Attorney General departmental bill. So the decision was made just to work off the Senate bill as it passed the Senate. So I sent a reprint that reflects the bill as passed by Senate Finance, and it also contains some additional amendments that the Office of the Attorney General has been working on with stakeholders. The bill as introduced broadened the definition of outpatient facility fee to mean a fee charged by a hospital for outpatient services provided in the state in compensation for the use of a hospital's facility, clinic, supply, or equipment, including the service of a physician or non-physician clinician. The bill as introduced also expanded the definition of hospital to include hospitals located outside the state that provide outpatient services to patients located in the state. In addition, the bill altered the required contents of the written notice of the outpatient facility fee, and it required the HSCRC to study and make recommendations regarding hospital outpatient facility fees and to submit a report to Senate Finance and the HGO. The Senate Finance Committee amended the bill to strike the expanded definitions of outpatient facility fee and hospital, which would have had the effect of requiring hospitals to provide the written notice of the fees in additional settings and for additional services. So the reprint before you strikes those expanded definitions. In addition, the alterations to the required notice, that was left in the bill. So the changes to the required notice remained in the bill. The Senate Finance Committee retained the HSCRC study, but the amendments before you alter the things that HSCRC and the stakeholders would look at in that study, and I can go through that if you would like. And then the amendments also require the HSCRC to convene a work group that will advise the HSCRC on expanding hospital outpatient facility fees notices to apply to all outpatient services. And HSCRC would report to Senate Finance and HGO by December 1st, 2024 with the work group recommendations.
Thank you. Let's see, I saw someone from Maryland Hospital Association was here.
Well, I think Heather from OIG, she would probably be
Okay, Heather,
best.
welcome.
Hi, thank you, sir. Yep. So the bill, as you see before you, although we weren't happy necessarily with what came over from the Senate, we've been working on it with the other stakeholders, and the amendments we feel are friendly amendments. They, allow the notice to be studied, the expanded notice to be studied by the work group, and then the report due at the end of this year, as Aaron said, and then a more impactful study due at the end of the following year on facility fees more generally. It does also, I'm not sure Aaron mentioned, I'll give some expedited procurement authority to HSCRC so that they can get the resources that they need for the study, which again was just a technical amendment and friendly. So we'd very much like to see this bill get passed and encourage you to do so, subcommittee to do so. Thank you.
So Heather, to be clear, the amendments that are before us address some of your concerns with the Senate version of the bill?
Yes. Thank you.
Okay, thanks for that clarification. Delegate Chalega.
Thanks, Chairman. So Delegate Robin Lewis and I have been working with Heather and others on this bill. and I saw it on the list and texted Robin to let her know we will be working on it. I would have a question about the work group that's on the reprint. Thanks, Aaron, for providing a reprint. Who is going to be on that work group?
Heather,
It says representatives of hospitals.
Yeah, representatives of hospitals, including those hospitals that are out-of-state hospitals that have in-state outpatient facilities. And then also representatives of from the Attorney General's office, from HSCRC, and from the Maryland Department of Health. Am I remembering everyone, Megan? Or
It
Deb,
says physician practices that provide services in hospital outpatient settings, healthcare payers, consumer advocacy groups, and representatives of employer groups. Okay. And Heather, you feel that is an adequate representation to make sure that patients are going to have adequate representation on that work group?
Yes, I think between the consumer advocacy groups and the representation from our office, and we also have other stakeholders in that group who are sympathetic to the costs borne by consumers in this space. So I do think that there's good representation for consumer concerns.
Okay. Thank you. I think, Heather has really worked hard on this along with the other stakeholders. So I think it's important that we get this pushed through before sine die.
thank you, Delegate Shalega. Hey, Delegate Taveras, can you mute, please? Delegate Taveras?
Delegate Jason Sandwich.
Thank you. We have some other people who I believe are here to speak on this bill. Anyone else care to be recognized at this point? Pegeen, go ahead.
Thank you, Mr. Chairman. I just wanted to put in a plug, and I've talked to the HSCRC about this, is to really move up the review of the notice before we start expanding what we're given notices about, and really try to bump that task up.
Megan, do you have a response to that?
Yeah, and Peggy and I have talked about this. We will do the best we can. I think, it always takes time to, even with the procurement flexibilities, to bring a contractor on board. So we will do the best we can. I am really dedicated to doing that. I think it's very important based on feedback we've gotten from stakeholders. But I also want to do it in ways that give us the best path forward we can. And it certainly would be easier to do over 2 years rather than one. So Peggy and I have talked about that. I understand her point. It's absolutely valid that if we're going to make recommendations about the expansion, that we also make recommendations about the form. And we will try, but I wasn't ready to commit to doing that because I think it depends on our resources and how quickly we can get things going.
So your preference would be to not accelerate?
Yes.
Okay.
That would be my preference, but I do not
wasn't
want to hold up
asking
this
for-
bill. This bill is important. So that's up to you.
I wasn't asking for any changes. I just wanted to make the pitch.
Yep.
About
Okay.
the need for revising the notice requirement or the notice form.
Well, it sounds like that's everyone's goal.
Yep.
Okay. Anyone else want to be recognized?
Move the amendments.
Thank you.
Second.
We have a motion and a second on the amendments. All in favor of adopting the amendments, say aye.
Aye.
Anyone opposed to the adoption of the amendments?
Move the bill as amended.
Thank you,
Second.
Delegate Shalega. Thank you, Delegate Kaiser. On the bill as amended, all in favor, say aye.
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 Any opposition to the bill as amended? Senate Bill 1103 moves on to the full committee with a unanimous favorable report. Thank
And
you.
it's a little
everyone.
backwards because you'll be hearing the full bill hearing today, so you're ahead of the game.
Okay.
Just worked out that way today.
Okay, good. Well, thanks, everyone. We got through the agenda. And I don't know if we'll be seeing each other again. What's your thought, Aaron? Will we be reconvening?
You might be.
We might be.
Right.
Okay.
You definitely will be.
Okay, there you go. Lindsay has
Okay.
something.
Lindsay, we definitely will be. Okay. Well, I'll see you-
Possibly twice.
Okay. Could be a busy week. Thanks again, everybody. We're adjourned.
Thank you. Bye-bye.